Ever noticed how oxygen device can all look simple until the flow rate is wrong? A nasal cannula, Hudson masks, and a bag valve masks may all deliver oxygen, but they don't work safely at the same flow rates. Sometimes the danger is not obvious straight away. Nasal prongs. If the flow is too low, the patient's not receiving enough supplemental oxygen. Too high for a prolonged period without humidification, the dry oxygen flow can irritate and dry the nasal mucosa. It can lead to discomfort, crusting, nosebleeds, thicker secretions, and reduced tolerance of the therapy. Severe irritations of the mucosa and mucosal injury can occur over time, particularly in vulnerable patients. So Hudson mask or simple face masks. These masks require a minimum oxygen flow to flush the exhaled carbon dioxide out of the masks. If the flow is too low, the patient can begin rebreathing their own carbon dioxide. So why does that matter? Carbon dioxide retention can contribute to headaches, drowsiness, worsening respiratory distress, confusion, increased worker breathing, hypercapnia, and respiratory acidosis in more severe cases. This is why simple face masks are generally run at enough flow rate to prevent carbon dioxide accumulation inside the masks. Evidence-based oxygen guidelines specifically warn against very low flow rates for this reason. Bag valve masks. Yes, bag valve mask will still ventilate a patient without the reservoir. But without this reservoir and adequate oxygen flow, the patient may only receive oxygen concentration much closer to room air. So this reservoir matters because it stores a reserve of high concentration oxygen between each breath. When connected correctly with sufficient oxygen flow, it helps increase the fraction of inspired oxygen delivered during ventilation, particularly important in critically ill patients. Without it, you will still move air, but you won't deliver the high oxygen concentration that the patient needs.